Hey, welcome back. We're going to go a little bit over how the low back is constructed. We were not meant to sit all day long, and unfortunately in our day and age that's exactly what's happening. We were meant to walk and move around a lot more than we do. Unfortunately, especially around this area, a lot more people are commuting. We are commuting for 2-3 hours sometimes. That's per day. And then we also have our jobs that we got to work at. We're on desk jobs or whatnot, or we're sitting for a good majority of the day. Unfortunately, that's more like back smoking. Okay, I'm going to call that back smoking. So the reality is that our backs over time will degrade. We end up with arthritis. We end up with lots of muscle imbalances, which is creating that arthritis and to begin with. And here's a little picture here to kind of look at. We have this little man here sitting, right? We have short and tight hip flexors. Okay, our hips are actually at an angle here throughout most of the day. That doesn't mean that they're strong, it just means that they're short and tight. So when you want to stand up, your hips still want to be short. Okay. You also have the elongation of your glutes. They do not want to work properly, and they are supposed to be the powerhouses. They don't want to work properly because they're overstretched throughout the whole day too. We also end up with tight paraspinal muscles, which is where you get probably the majority of your back pain from, is that those overfire as a result of your glutes not working properly, and they're trying to counterbalance the hip flexion. Then we also end up with hamstring issues, and you know what, I hear that time and time again, a lot of people have tight hamstrings. They just don't have the ability to even touch their toes anymore. All of this is part of the same demon. So, getting this under control, rebalancing this out is the name of the game. We have our brain that's supposed to be connected to all 24 pairs of nerves. The last 5 in your low back, because of the deformation that's right here and the degradation over time, the muscles get used to being in those positions. So for me to go and correct that is top priority for number one, and then to get the muscle imbalances out after we get that brain connected so that we can do the stretches and the exercises properly, so that you're not cheating and posing a risk for injury. So there's just a little bit of a health tip for you. We'll keep pumping them out for you. Keep following us, guys. All right, so this is kind of a part 2 on the low back that we were talking about. In order to kind of help balance that out, we're going to be doing, these are my 3 main go-to exercises to kind of help balance that out. That doesn't mean that there aren't other exercises that are helpful and that we won't add on exercises later, but these are my 3 go-to exercises. The primary stabilizers of the low back are the multifidus. That's the guys right in here. They're actually deeper than the paraspinals, which get overfired because we're sitting too long. So that's one that you'll want to do the quadruped for. And in order to do the quadruped, you just get down on all 4. Quadra means like on all 4. And what I like to do is I like to just put my arms straight, my legs straight on the opposite side. So right arm up, left leg back, and we'll have that one straight in the back. I don't like lifting that because that can imbalance the hips. We want it straight. Okay, so you want this straight. You'll hold that just for a second. Just 1 second's good enough, just like that, and you'll switch it. And you'll keep switching it just like this. And you'll want to do like 45 of these repetitions 3 times. Okay, I like to do a lot of my exercises, all of them about 3 times, just to kind of get the body used to those exercises. So that's how you do the multifidus. Another one is just to do a general plank. Obviously you can do it from the knees to kind of help alleviate some of the, if you have a little bit of shoulder pain, or if you need to modify it a little bit for yourself, you can do it from the knees, but it's just keeping it straight here. You'll hold this for 30 seconds and you'll do that 3 times as well. You can increase the time as well, but you just want a straight back. Okay, nothing crazy. If you need to modify it, put your pressure on your knees instead, just like that, and just hold that for 30 seconds. And then after that, just relax. That's how you do a plank. You want the plank instead of doing sit-ups. I'm not a big fan of sit-ups because you get a lot of hip flexion. And that's the guy that's already short and tight now and ornery. So you don't really want to be doing that. You want to elongate it and you want to strengthen them up. Okay, the last but not least is like back bridges. I do like doing back bridges and squats, but back bridges, and again, one I'm going to go to. So in order to do the back bridge, you'll flip over, you put your knees together, your feet together, and you want your feet kind of close to your hips. Okay, so you want them kind of close to here. You don't want them all the way out here, and you don't want them away. You want them in and close to your hips as much as you can. From here, my hands are to my sides, and I lift straight up, and I hold that 1, 2, 3, and relax. I'll do this 15 times and I'll do it 3 sets, okay? So those are my 3 main go-tos to get you out of trouble, all right? Keep following us, guys. We'll keep throwing out more health tips for you. All right.